and I am the Deputy Director of your New York State Association of Counties, and I'm pleased today to host this webinar with Trellis Marketing. Today's webinar is about maximizing your opioid and JUUL settlement funds, evidence-based awareness and prevention campaigns. The discussion is designed to focus on innovation, turnkey approaches to using opioid abatement and JUUL settlement funds to support the prevention, education, and connections to care in your community. This webinar highlights county-branded awareness and education campaigns designed to help counties maximize settlement funding through evidence-informed messaging, targeted media strategies, and measurable outcomes. Attendees will learn how communities are using these initiatives to reduce stigma surrounding opioid use disorder, strengthen access to local resources, and reach youth and caretakers with meaningful vaping prevention messaging on the platforms they use most. The session will also explore successful partnership models emerging across New York State and provide practical, scalable ideas for counties looking for impactful and easy to implement solutions. Before we begin, I want to turn to Jeanette Stanziano, NYSAC's Director of Education and Training, for some housekeeping comments.
Thank you, Mark. Welcome, everyone. I want to remind you that this webinar is being recorded, and we will send you a link plus a PDF of the PowerPoint slides at the conclusion of the presentation via email. We will also have this posted on the NYSAC website under webinars, as well as on the NYSAC YouTube channel, NYSAC TV. We want to encourage you to feel free to submit any questions by clicking on your questions tab of your dashboard and typing them in. You can type them in at any time during the presentation, and we will have a Q&A portion at the conclusion of the presentation where we will go over your questions. Back to you, Mark.
Thank you, Jeanette. Our panelists today come from Trellis Marketing, a firm that NYSAC has worked with for several years, starting with a campaign with the county corners to educate the public about the harms of opioid use disorders. Our first speaker is Amanda Lucchino, partner and director of business development for Trellis. Amanda brings over 20 years of marketing experience and serves as partner and vice president, making her an ideal lead account manager for this work. She has spent her career partnering with counties, municipalities, and government agencies throughout New York State, with deep expertise in grant writing, securing state and federal funding. That experience translates directly into public sector campaign management. Amanda has helped stand up statewide and countywide vaping settlement and opioid awareness campaigns, guiding them from funding through launch and execution. Her fluency in both the grant landscape and the realities of municipal partnership positions her to manage county campaigns with strategic insight and a results-driven approach. Cheryl Moore is Trellis's senior opioid advisor. Cheryl is a nationally recognized public health leader with more than 25 years of experience addressing complex health challenges. A retired medical care administrator for the Erie County Department of Health, she founded the Erie County Opiate Epidemic Task Force and established the county's Office of Harm Reduction, leading innovative initiatives that have earned national recognition. Today, she advises counties on opioid settlements, spending strategies, and serves on the New York State Opioid Settlement Advisory Board and the BGA National Peer Advisory Board. Cheryl's expertise in harm reduction, community engagement, and evidence-based public health strategies makes her an invaluable advisor in developing impactful opioid awareness and education campaigns. It is my honor now to turn the mic over to Amanda Lucchino. Amanda.
Thanks, Mark. It is such a pleasure to be here. We could not be more excited. Thank you to NISAC and the partnership that we've had so far. So all that being said, let's jump right in here. I know you guys are very busy, so we want to make sure that we go through everything that we have in store for us today. So what we're going to talk about, practical strategies to increase awareness, connect residents to care, and measure community impact with evidence-based PSA campaigns. So what we're going to talk about today are how counties are using settlement funds to educate residents and reduce stigma, ways to reach youth, families, and at-risk populations where they already spend their time, how county branded awareness campaigns can connect residents directly to local resources and support, real examples from counties already implementing education and awareness initiatives, and how to measure impact and demonstrate responsible use of these settlement funds. And all of this is so that we make sure that our settlement dollars go far. We know that every county is different, and we're here to provide ideas, examples, and practical strategies that can be tailored to each community's needs. Okay, when utilizing JUUL or opioid settlement funds, county departments and CBOs are expected to educate residents, reach people before a crisis happens, create a local trackable multimedia education campaign, connect residents to trusted local resources, demonstrate measurable community impact. In many cases, even if local staff expertise are available, they're expected to do this additional task with no additional time. So we know that counties are being asked to do more than ever before. And the challenge isn't just creating awareness, it's reaching the right people with the right message and showing the impact. So with that in mind, based on the demand we've seen repeated in the counties, we have created a turnkey solution that helps do all of this for you. So let's talk about what this should look like, or what a successful campaign should include. So first, it needs to reach people where they already spend their time. So for example, I love to tell this scenario. I was recently getting ready for work. We work from home, so I was religiously watching the Today Show, and I saw a really great vaping prevention campaign PSA come on, and I was like, wow, that is really good. That's really good. Now, the only thing as I kept thinking about that was that is supposed to be towards young people. And right now, I can't imagine my 16-year-old stepson watching the Today Show, having his morning coffee at 7 a.m. before school starts. That's just not where youth are. So it's really important that when we build a successful campaign, we're reaching the right people where they actually are. And we do this in a few different ways. We do social media, we do streaming TV, we do YouTube, and we do all of the digital platforms that you can imagine. So we want to make sure that when we build a campaign, we're actually meeting people where they are. The second part of this is we want to connect every resident to local resources. So not only are we reaching the right people with the right messaging, we are sending them to a place where they actually can get connections to care. So county-specific information, local providers, treatment options, prevention programs, community supports. And so another way that we're going to actually get them to do what we want is to deliver messages that are actually relevant and easy to find. Prevention, education, hope, recovery, and resources. Okay. And then once we hit them with the messaging, we send them to the local resources. We start to measure the results. So we do this by measuring campaign reach, their engagement, the landing page activity, the resource utilization, and the overall community impact. So the goal isn't simply to raise awareness, it's to make it easier for residents to find help when they need it most. that most effective campaigns don't stop at awareness. They create simple path for education and action. So this little flow chart, let's talk about the system here. So we've distilled this down so that you can actually see at a very quick glance how the system works. It's county branded messaging that when your community actually sees it, they're going to say, oh, hey, that's speaking to me. Not only is that message speaking my language, it's brought to me by my county. It says Washington County, it says Otsego County on there so that I know it's not just out there floating in the universe. Someone's trying to tell me to do something. It is localized for your community. From there, once we brand this county messaging for your county, we choose the media where your community actually lives. So based on whether it's opioid messaging or vaping messaging, we decide and determine with you where the most likely platforms, what the most likely platforms are that your residents are using based on the audience. And then from there, we send the viewers to a custom landing page with your county connections to care. We do this for every single county or organization, and we encourage putting everyone in this fight in the sandbox together so that we get people the care that they need, no matter where it comes from in real time. From there, we start to aggregate the data, providing custom quarterly reports and analytics. And we make those reports easy to read and digest. We also meet with you, like I said, every quarter to break down exactly what that data is showing us. And from there, based on that data, we can bob and weave and actually move the media to what's actually working best for your county. And every county is going to be a little different. And the way that those residents react to specific messages could be different based on that community as well. So based on that report, the campaign can be fluid. It's not just a set it and forget it. We're bobbing and weaving with what actually is working in real time. One other thing that I wanted to mention in this system is the notion of sustainability as well. So after this campaign wraps up, I also want to mention that the county or the organization that adopts this program will have access to the county branded PSAs forever. So even though your campaign might be over, we encourage you to send those county branded PSAs to everyone that you've included on your landing page. Anyone that will play those PSAs in your community should have a copy of them. And then after that, they have the autonomy to also run their own social media campaigns using those actual PSAs as well. You'll have them for the duration. Okay, moving on here. Let's start at the beginning of the system with our custom brand and PSAs and messaging we chose. So the messaging that we chose is very, very important. The PSAs are built for the intended audience and they're intended to look a little different. So my type A brain, when we were creating these PSAs, said I kind of all want them to have the same look and feel. But very quickly, I was shot down by the team and they said, well, no, these have to be designed for the actual people they're intended to impact. And so what we did here was we took local and national curricula from Roswell Park, the Stanford model, and Johns Hopkins, and we distilled what the best messaging would be for the right audience to get them to act. So opioid messaging example topics include reducing stigma that would prevent people from getting help, the dangers of recreational opioid use, stories of real people and their journey of recovery. And then for vaping prevention and cessation, linkage messaging example topics include environmental impacts of vaping, the right to choose messaging, and health impact messaging that is actually related to youth. And we all know that young people, their brains just think a little differently than ours. So we have to make sure that whatever we create for young people, especially between the ages of 11 to 17 and 18 to 25, it actually is going to be impactful. We know that their attention spans are much shorter than ours, and we know that we need to hook them with something that resonates with them within the first 3 seconds of showing them an actual PSA. So for the vaping cessation PSAs, we've broken down the PSAs specifically for those audiences. Again, that's 11 to 17, 18 to 25, and for their caretakers as well. And so I should also say that the PSA library is always evolving. So as we continue to engage with our counties, we're listening to what's actually emerging in terms of trends in opioid use and vaping. And we're continuously creating scripts and producing commercials or PSAs that hit on that topic. We're also creating PSAs that are unique to each community based on local needs and actual data. So for example, we engaged with the Seneca Nation, and their needs looked a little different from some of the PSAs that we had created, and it focused on generational trauma. And so because of that, we created their own PSAs that really resonated with their community. And we've done that for several other topics as well. And it doesn't have to be a full suite of PSAs. It just can be maybe 1 or 2 supplemental PSAs that really hammer home, a specific topic that you want to educate your community on. So let's go right in. I've got some PSAs that I actually want to share with you. I believe the first one, yes, is our opioid awareness and education PSAs. Now, this is just a sample. There's over 13 different PSAs. These are just 3. There is a whole suite of peer recovery stories. This is just one of them. Jeanette, if you want to go ahead and play the first one, Stories of Hope from Edward. Yep. Yep. Working on it. Oh no, we're not hearing any sound. Jeanette, I don't know if you can hear it, but we are not hearing any sound on our end. Stand by, folks. There's always some kind of technical difficulty here.
There are resources available in
There we go. If we want to start from the top.
Yes.
Perfect. Oh, I think we got to go back. Oh, but the sound is off still. It wouldn't be a webinar or a meet without some kind of technical difficulty. Jeanette, there's still no sound. There we go. We got it for a second and then it went out.
Okay. I apologize. I am hearing the sound. May I ask somebody who's in the audience to send in the questions tab or the chat tab whether you have heard any audio since we hit play? Sometimes panelists don't hear the recording, but the attendees do.
Okay.
Okay, no sound. My apologies. I will have to figure out what's going on. All of the audio was on, and if you could just give me a moment, I will troubleshoot this.
Sure. While we're waiting, you can see on the screen this PSA has been, how this PSA has been custom branded for Livingston County in the bottom right. And so that county seal is played throughout the duration of the PSA in the opioid prevention spots. And then on the end slate, you'll see the actual QR code that will take people to the Connections to Care, the landing page, in addition to the county website. An actual county landing page URL specific to that county. And you'll see once we get through these opioid spots how the vaping PSAs are a little different in that they're shorter, especially some of the ones for youth, because we want to make sure that we, again, get that content out within the first 3 seconds of a young person seeing it. We also intentionally did not put any branding in the first part of the vaping PSAs because data has revealed that as soon as a young person clocks messaging as a PSA, they will immediately swipe over it. So we saved that messaging to the end of the vaping PSAs.
Okay. I am not going to hold you up. I think what we should try to do is show the videos. All of the audio is on my end, but I realize that it's not going through. But I have to say I've exhausted all of my paths to find out why we're not hearing this particular audio. So the only other thing I can think of is to show it visually so that you can show the branding.
Sure.
I know that's not ideal.
Yeah. That's okay. So I did just talk about how in the opioid PSAs, there's branding throughout. This is the end slate in marketing terms that we talk. It's just the final screen or final frame that's got the URL, the QR code, and then, of course, the county seal to the bottom right. And so that's rinsed and repeat for each county or organization that participates. So that PSA, when it's served to your county residents, will look like it came from your county. Okay, if you want to go back to the actual presentation, Jeanette, we'll go to the slide that's got the 3 different opioid awareness and education PSAs. I think you have to drop out of that Dropbox screen to show the full presentation.
Yeah. This Dropbox is, of course, to add insult to injury, is not allowing me to close it. So I'm going to shove it as far to the side as I can. Okay, this is, small nightmares, but we're going to get this back.
We'll get through it.
Yes. Try to close this down again.
Okay.
All right.
Perfect. So this next slide, and that's actually perfect where it is. These are still shots of examples of the youth vaping prevention education PSAs. You can see still choosing that messaging is for the audience between 18 to 25. That is actually the end slate that you see there on the screen with the QR code, the URL unvapealbany.org, the NISAC logo on the left. And then the middle one there, Keep the Door Open. That's a series that actually came to us from one of our county partners that has personal experience with his teen that was caught recently vaping, but the whole series is surrounding Keep the Door Open, where it's encouraging parents and caretakers to talk to their kids or their youth early and often to make big conversations easier when it comes time for them. And then the last one is environmental impact. And that really speaks to that bucket of audience between 11 to 25. And so those are just examples. And at the end of this, you're going to actually get a link for the presentation. So you'll be able to see these on your own as well. We can move to the next slide, Jeanette. So the second part of the system, and also the most important to get right, is the placement. So not only is it important to have the right messaging for the right audience, but like I said earlier, it's also important to make sure that we're actually placing that message where people are. So for example, our platforms that we use geared towards the youth are Snapchat, Instagram, and YouTube. Now, I'm 44 years old. You won't catch me on Snapchat. You just won't. You also won't catch me on TikTok, which is a new platform that we actually recently adopted that can play these PSAs as well. So, but for the youth, that's perfect. We're not going to see young people watching today's show. We're actually likely not even going to be seeing them streaming TV. However, there is a streaming component to this as well. But all of our youth messaging is geared towards Snapchat, Instagram, YouTube, and TikTok. And then for targeting caretakers and youth, that's where you're probably going to find me, which is Instagram and Facebook. And so we're choosing the right messaging, and we're choosing the right platforms to actually serve these ads. Now, I should also mention, we love social media because it provides us really robust analytics as well. So not only are we able to see, who's coming into these platforms and when on the landing page, we're also able to take the data from these platforms directly. We can move on to the next slide, Jeanette. Oh, yep, streaming audio and video, Spotify and YouTube.
I wanted to give you the option, Amanda, I did embed some, upload these videos in addition to your embedding, which I was using before. I wanted to see if you would like to try to run them through the uploaded actual video links to see if there is any audio. If you don't, I'm happy to move on.
Would I need to do that on my side?
Nope, I could do it right here.
Yeah, I mean, I think that's what I think people would love to see that.
All right, let's give it a try.
I'm not seeing anything.
Okay.
Or hearing anything.
Okay. Worth a shot. That did not work.
That's okay.
Apologies. We're going to go back to the presentation. I'm going to pause sharing for a second. We'll get back. We'll close this down. Okay.
All right, so we'll go to the streaming audio and video Spotify YouTube page. So we can advance 1 click, 2 clicks. Yep, right there. That's perfect. Okay, so we also will deploy Spotify ads and YouTube ads, specifically, again, for young people to make sure that we meet them where they are. Originally, when we talked, our media director came to me and said, we should definitely, consider Spotify for this because regular radio ads, young people just are not there anymore. And I said, I don't know about that. I don't hear any ads on Spotify. And he said, well, that's because you pay for Spotify subscription. Most young people have the free version, and the free version has these ads. So that was a great point. We added this to our mix. We also added YouTube because, of course, young people, especially that bucket between 11 to 17, are consuming their information and content through YouTube. So the PSAs will also be played through there. We can keep moving, Jeanette. All right. Streaming video is also where you will see this. And so I get a lot of questions, well, what does streaming mean? And sometimes I over-explain this. I was just actually talking to Cheryl about this yesterday. Streaming TV essentially is anywhere you're consuming content on your TV in your home that is not connected to a cable box or that is app driven. So recognizable platforms include Pluto, Tubi, Zumo, which is the Spectrum app. Philo is another one. You can also see these PSAs on all of the premium networks. These are just a sample of them, but we're meeting the audience. So sometimes people will ask, well, I don't think that my child is going to be found on the History Channel. That really doesn't matter because it's not like the PSA is playing in the absence of the person viewing. It's only played when the TV is on and they're on a network. So we're targeting the audience. We're not actually targeting the network. So we love streaming ads and we love social media ads because unlike broadcast TV, there's absolutely no waste. The ads are only counted as being seen if they're actually played and the person is actually viewing. So streaming TV and social media are big components to these PSA campaigns. Next, we have digital ads that are also deployed. These are examples of what they would look like for our opioid campaigns and what the messaging would look like. We also love these because they're a clickable event, which means that when you're in the wild and you're surfing the internet, you see this ad come up to the left or the top of your screen, you can click through to that and it will take you to the landing page. We love anything that is actionable. So we do also deploy these as well. Next slide shows outdoor ads or billboard ads. This is just an example of one that we mocked up for Steuben. Now, we understand that probably for rural counties, this might not make sense. For urban communities, this does absolutely make sense. Other messaging or platforms in outdoor would include bus stops, vehicle wraps, bus wraps, also can be included in this campaign as well. In the vaping cessation or prevention education campaign, we also deploy flyers and posters that, of course, are county branded with the QR code that takes people to the landing page that are, of course, encouraged to send out in and around the schools, any of your community organizations, doctors' offices. But the idea is not only are young people seeing this all over their platforms where they are, they're actually seeing the same messages again in the wild. So the messaging that we have, we actually formatted them for people seeing them in places like the locker room, in the hallway of their school, in the bathrooms, actually. So there's actual messaging identifying that, hey, I know that you're seeing this in the bathroom, but before you suck on that vape, consider this, right? So we're trying to make the messaging impactful so people actually pay attention. And in that moment, we can give them the connections to care that they need. The next slide is an example of the custom landing page. Now, this one is custom for, I believe it could be Steuben or Steuben County. All of them for the opioid look very much the same. It has connections to not only local, but your state and national resources as well. But anyone that is relevant in your community that should be on this landing page, we are encouraging you to do so. And so for the vaping PSA, it looks a little different. The color scheme is different. I'm sorry, the vaping landing page. The color scheme is different. The messaging is different, but the concept is the same. We're connecting your community to the resources to care that they need. And the next slide, this is just a sample of the quarterly analytics and reporting. So one thing that I've heard from the counties is, okay, we've tried all of these different tactics. Now we're getting all these reports from all these different places. I just wish we could get one report that aggregates all the data across all the different platforms that we've deployed messaging. And so that's exactly what we did. Not only do we aggregate the data from the landing page, we put all of those tactics together and we provide you one comprehensive report that reports on all the data across all the tactics that you've deployed for that particular time frame. We also formatted it so that it's very easy to read with how much you've spent up until that time, the goal and strategy, the tactics that you've actually used, because let's face it, you guys are doing a lot of different things. You're wearing a lot of different hats. But from the time we start the campaign and from 4 months and then 8 months and then 12 months down the road, sometimes it's hard to remember what you even started to run. So we put that in the report so that you know exactly where you are and what we're reporting on for that particular time frame and what money has been exhausted. Next slide. Okay. And with each engagement for the campaigns, there is also a press outreach that is regional and national. So we can start to get legs from this initiative from all over the place. And so we'll request county quotes so that when the press actually picks this up, they can do interviews directly with the county officials, and hopefully it's shared and the stories are told over and over again to help get this campaign even and moving further through the county and the region. And so let's recap how this helps the county. It's a full turnkey solution designed to strategically deploy opioid and JUUL settlement funds with ease and accountability. It's evidence-based messaging grounded in data, behavioral research, and nationally, regionally adopted curricula, custom county branded PSAs that reflect your community that build trust. It provides direct connections to care, highlighting real, accessible county resources and support services. It provides comprehensive reporting and analytics, providing transparent performance metrics and measurable impact. We provide end-to-end campaign management from strategy and creative through media placement, ensuring the right message reaches the right audience. There's high visibility press support, including a professional press release to amplify the reach and public awareness. And it's proven, results-driven, a system built for adoption, sustainability, and real community impact. And so the last slide is a sample of an awareness and educational PSA campaign based on population, frequency, and reach for 1 year. Now, of course, all of this can be customized. I typically, when I talk to our counties, I say, listen, we're going to talk about this turnkey system. However, if you've already got initiatives running in your community, in your county, we can always do a tailored campaign or an a la carte campaign using any of these tactics and be happy to create a custom campaign for you. Now, the other thing that I should also mention is that partnerships are happening and they are encouraged because, as you know, your county residents are going sometimes from county to county. For example, I live in Erie County, but my family lives in Niagara County. So I would be served, it makes sense for me to be served both ads or at least consistent messaging throughout the region. There's also BOCES county relationships happening as well, or partnerships happening as well. For example, I just had a meeting with City BOCES and Oswego County and Oswego City BOCES from Oswego County that are doing a joint partnership utilizing both buckets of their JUUL settlement funds as a joint initiative. The county focusing on pretty much everyone, all the caretakers or older population in their county, while City BOCES is focusing on making sure that it's the most impactful within their school districts. So those are another examples of how this campaign can get funded if there's concern about where the dollars are coming from. But those partnerships, that one has been exemplary. And I know that there's another couple instances like that that we're working on as well, that we're very excited about. And so before we open it up to discussion, I want to just say that our goal for all of our partnerships is that we want our counties to treat us as though we're in the next room. We work as your fractional marketing department for small counties that don't have the resources, and for large counties that do, but might need a little extra bench strength when you're already really busy. So that's how we approach all of our partnerships. We're here for you for whatever you need in whatever capacity. This turnkey system has been really great success for our partner counties already, and we're happy to bring that to you as well. So before we go anywhere else, I think that we've got some time still for questions and discussion.
That's correct, Amanda. Thank you very much. This has been a good presentation. Listen, folks, we have seen all of these videos, and they're great, and we encourage you to, when the recording and the presentation are available on our website, to come out and take a look. Look at the videos, share them, pass them around. That's one piece of the marketing campaign or the prevention campaigns that Trellis has in their packet of information. So I appreciate that you sticking with us. Amanda, I appreciate the content. I encourage folks that are on the line right now to ask questions of Cheryl and Amanda if you have them. First question that I have, Amanda, is how many counties has Trellis worked with so far?
Oh man, at least a dozen, and some of those are counties, some of them are LGUs that span several counties together. Seneca Nation is a great partner of ours as well. So I would say at least a dozen. And so also I should say that the vaping PSA really just launched about 6 months ago. So we're still really new in the JUUL education prevention campaigns, but that really has shown the most demand from the counties. And actually that we responded to a call from Livingston and Steuben County that said, hey, that were working with us for opioid. They were the ones that came to us and said, hey, this is working so well. The system's working so well for our opioid campaign. Is there something that you can do similar for the JUUL settlement for vaping prevention and education? And we said, absolutely, we can absolutely do that. And so that's really how we got into the vaping prevention and education.
That's great. And we appreciate you pivoting to help our counties out there.
Yeah.
So I have a couple of general questions that have to do with the JUUL settlement and the opioid settlement. And in our webinar page, where we list the link to the recording and a link to the presentation, we will also provide some links to the Attorney General's office that explains both settlements. So that can answer some of the questions that folks have about the settlements in general. Next question. I was interested to learn how to tell which funds are restricted or not restricted. Any help on that, Amanda or Cheryl?
That would be a Cheryl question.
And that would be something you would have to refer to your local attorney or the Attorney General's office.
Okay. So hopefully some of that information in the Attorney General's links that we have up there will provide that.
Perfect.
Okay. Well, at this point, we do not have any additional questions. I encourage you, if you have questions after this, to go ahead and send them. You can send them to Jeanette. You can send them to me. We will get them over to Amanda and or Cheryl. You have Amanda and Cheryl's emails on this last slide as well. I want to take this opportunity to thank our speakers, Amanda Lucchino and Cheryl Moore, for sharing their time, expertise, and practical insights with us today. We appreciate the work they are doing to help counties make meaningful, effective use of these settlement funds in ways that support prevention, education, and healthier communities. I also want to thank all of you for joining us today and for the important work that you're doing every day on behalf of our communities. At NISAC, our mission is to foster excellence in county government. And one of the ways we do that is by providing educational opportunities like this webinar, designed to inform, support, and connect our members as you address the issues facing your communities across the state. We hope today's discussion has been helpful and that you leave with ideas and resources you can use in your own county. Thank you again for being with us, and I wish you all the best for the rest of your day.